Hello and welcome. We're glad to see you this way. Usually, I think I recognize a few of you from the one in-person sessions that we've done in the past with a few of our other doctors. So I'm excited to see you that you're up and about and at home and safe and doing what you need to be doing to be healthy. Today we've got Dr. Roya Mojarrad, who is from the Simi Valley practice at UCLA Health up the street on First near the town center. I'll put the information as to where we're located in the chat box if you know how to use that, and some information regarding UCLA Health and seeing your doctor in that chat box as well. Dr. Mojarrad is board certified in family medicine. She earned her medical degree and completed pediatric residency at the Shahid Beheshti University in Tehran, Iran, before moving to the United States. Dr. Mojarrad then completed her second residency in family medicine at Indiana University and worked for many years as a family physician. She sees patients of all ages, including children and seniors, and you name it, she sees them all. I know that. Clinical interests include chronic and acute disease, preventative care, sports medicine, infectious diseases, women's health, adolescent and pediatric care. In her free time, Dr. Mojarrad enjoys spending time with her family and traveling. With that, I'm going to introduce Dr. Mojarrad, and she's going to take it from there, and she's going to be running a little PowerPoint that you should be able to see on your screen and speaking to the slides on the PowerPoint. Dr. Mojarrad?
Yes, hi everyone. Thanks for being here. Thank you, Claudia, for introducing me. So I work at Simi Valley. As Claudia said, I'm a family physician, primary care. So I'm happy to be with you today to discuss a little brief about the healthy diet, especially in this situation that we have COVID. So it's not changing the slide. Oh, okay. So as I said, we are going to talk about eating your way toward the healthy immune system during COVID-19, which actually is, there is no diet, no supplement that we can say that can help us to prevent to get COVID, or if we get COVID, can treat the COVID. But for sure, if we help with our immune system, we have a strong immune system, our body will be strong, so we can fight with the virus. One of the main things is having a good caloric balance and weight, because if we don't have a good healthy weight, it can increase most of the medical problems. It puts us in the high risk group. But COVID is another one. So if we get COVID, it can make us sick if we don't have a healthy weight. So definitely looking at our calorie to having a healthy weight can help us to fight with this virus. So we have to, to have a healthy weight, we have to make sure that we should limit our calories, which I will talk to you now, calories that are not healthy. So limit those, and having more physical activity so we can keep our weight. There are ways, calories different for different age, sex, but overall, to make it easy, you really don't need to calculate, but I brought a brief numbers of the calorie for male. Usually, it depends how much activity we have. We have sedentary life, moderate active, or we are active. Sedentary means, if we are just doing the household works, we are not going to walk, we are just doing our work at home. Moderate activity means, we can, we do a little more walking, more exercise, something between 1 to 3 miles, if we walk, that will be moderate active. Active means if we do more than that, we walk 3 or more miles a day, so that will be active. So if you can see, for male, so overall, if we are not doing that much, then, we don't need more than 2,000 calories. For different ages, 61 to 65, up to older than 76. The calorie is almost the same. With moderate activity, it goes a little higher. So these are the numbers, and active a little higher than this. For female, is a little calorie intake is a little less. So something like 1600 for sedentary life and a little more if we get active. So we have two kinds of nutrients. They are macronutrients and micronutrients. Usually macronutrients is the one that is our main food. We have, our carbohydrate, protein, fat, fiber. These are the bulk food that we eat. So we have to make sure that we have to eat this, but we have to make sure how much we are eating this and what is the healthy part of those, so we stay healthy. Carbohydrate, as you know, carbohydrate are usually anything that are sweet, bread, rice, potato, pasta. These are all in the carbohydrate group. So it should be something like 45 to 65% of the calorie we should, it should be our carbohydrate. But we have to make sure to choose the carbohydrates that are healthy. One of them is the carbohydrate that are low glycemic index, because the glycemic index is very important in carbohydrate. For example, if we eat a simple sugar, it has a very high glycemic index. So it's not healthy. Simple sugar like, sweets, cookie, candy. But white bread has a very high glycemic index. But if, for example, we eat something like whole grain, it has less glycemic index. Fruits has sugar, but the glycemic index of fruits are very low. So if we choose carbohydrates that has low glycemic index, it's going to be healthier. We have to make sure, to avoid adding sugar to our diet. Adding sugar is like, for example, the beverages that we drink, they are sweet, they have a lot of sugar. Fruit juice. Fruit is okay. We don't have to really worry for the sugar in the fruit, milk, these are natural, healthy sugar. But if you remove the fiber from fruit, if you make it fruit juice, then that's different. So that glycemic index will increase. So fruit juice is one of those that we, as much as we can, should avoid it. And processed food has a lot of sugar in it. So, and you can look, if you're eating the processed food, you can see, how much they have salt, how much they have sugar. So processed food is one of those that, is better to avoid to stay healthy. The other macronutrient is protein, which is one of the important part of our food. It should be something between 10 to 35% of our calorie intake. It should be protein, but we have to choose the healthy proteins. Healthy proteins are, something like fish, lean meat, poultry, eggs, beans, they have a lot of protein, and the peas, soy, nuts, but we have to make sure we do the no salt or low salt nuts, because then if you add salt, then it will not be healthy. And the seeds, these are the main healthy protein. Red meat also has protein, but that's non-healthy protein. So you have to, as much as we can, we have to decrease the red meat in our diet. The other one was fat. Fat, usually it should not be more than 20 to 35% of the total calorie that we are taking, not more than that. But it's more important to choose what kind of fat we are eating than the amount of the fat. Trans fat are the worst fat that we can eat. Trans fat are, fats that we can have it, for example, eat frozen pizza, it has trans fat. French fries, fried chicken, they all have trans fat. Maybe something that, we don't know, a lot of us, we don't know that, non-dairy calorie creamers, they are trans fat, so it's better if you want to drink a coffee, add milk than these creamers, they are trans fat. Biscuits, rolls, those all, especially if you put in the refrigerator, you make it cold, the trans fat will increase. So try to avoid these trans fats. Healthy oils are, olive oil, grapeseed oil, canola oil. So these are healthy oils. So if you are choosing fat, it's better to choose the healthy fat. Fish oil is another one, at least we say, 2 serving of fish, oily fish, in a week, to keep you healthy. If you don't want to eat fish, you can choose fish oil, maybe one fish oil, 1 pill of fish oil a day, you can get enough healthy oil. So the research they did, higher trans fat and saturated fat increase the coronary artery disease, heart disease, stroke, diabetes. So the other one was fiber. So the fiber is a portion of the plant that our body cannot digest it. So it stays in the bowel. So when we eat fiber, it doesn't let we absorb the sugar and cholesterol when it's in the food. So they said it's better to be 14 grams per 1,000 calories. So if, for example, we are having 2,000 calories, we are eating, as I said, the calorie count. If it's 2,000 calories, so it will be something like, 25 or a little higher, better, 36 gram fiber a day. It will be a healthy fiber to eat. Fiber is in a lot of things, fiber in fruits, fiber in grains, but it looks that fiber in grains, it's healthier than, it has more benefit, I can say, than fiber in fruits. So, like whole grain, those fiber works better. And so as more fiber we have, coronary heart disease can decrease, colon cancer decrease, stroke decrease, and type 2 diabetes. And even they did a research in patients that they had heart attack. If they eat more fiber, the second heart attack decreased, the risk of the second heart attack. So this one, this is not in my slide, but I printed, if you want, I can send you overall this list of the fibers for you later, because it was interesting even for myself. We don't know what is, how much fiber different foods has. For example, it says apple has, just one medium apple has 4.4 gram fiber. So as I said, 14 gram for 1,000, so 3 apples will be, you're getting at least half of our fiber. But, banana has, for example, one banana has 3 gram of the fiber. Juice, apple juice has 0.5. So see, it's just, it's waste to drink juice because we are getting sugar and we are not really getting fiber of it. Vegetables has good fiber, especially between vegetables. Peas, it says 8.8 in 1 cup. So that's a very good amount of fiber. Green beans has 4 gram in 1 cup. The other vegetables also, but still the best I can tell you, it's the legumes like, beans, kidney beans, those, they have a lot of fiber. 1 cup of them, they have almost 13.9, almost 14 gram of fiber. So definitely make sure those are in your diet every day. Breads also, it depends what kind of bread, whole grain bread, it says, for example, has 1.9, one slice of it, 1.9 gram. White bread is the worst, 0.6 gram of the fiber. So if you want, I can send this list to you. It's good to know, so what we are eating, how much fiber we are getting. So make sure at least you get, for normal weight, at least you get 25 gram of fiber a day. And the other ones is micronutrients, which are, vitamins and other small amount of things that we add to our food. So sodium is one of those. Sodium, it's better to keep it less than 2,300. So it will be almost half a teaspoon. So I can tell you, everything almost has sodium in it. Most of our foods, it has sodium normally in it. So it's better you don't add any sodium, because with normal food, you're getting this amount of sodium. Because if you get high sodium, it can increase the risk of hypertension, coronary artery disease, and stroke, and, it's not healthy. Salt preserved food are the worst, something like, salted fish, we have your pickled. Beside of it, they have a lot of salt, they notice that it can cause stomach cancer. So try to avoid those as much as you can. Calcium is one of the important things that should be in our diets. Usually for postmenopause, We recommend something like 1200 milligram a day, but before that, or for male gentlemen, it's something like 1000 milligram a day. So, but just maybe I should tell this, you should not take the whole thing at the same time, because every time we take calcium, we only absorb 500 milligram. So you have to divide it, maybe if you're taking 1000, divide it to 2 times. So, and don't take, for example, if you're taking calcium pill, don't take it with milk, because it will be waste. You will only absorb the 500. And make sure take it with food. So if you're taking calcium pills, it will absorb better. And they noticed that calcium can decrease colon cancer. There was a research that they saw that it can decrease the colon cancer. The vitamins, vitamin D is very important, something like 600 milligram, 600 units a day, we should take vitamin D. And for age 70 and older, it's 800 units a day. Folate is another one, we need it for our blood to have for anemia and blood, we need that. B12, sometimes, especially if patients are vegan, they're not eating too much meat, we may not get enough B12, especially in elderly, the absorption may be a little lower. So make sure, at least take, B12, you can take 500 microgram. There. And the other vitamins, and honestly, if you're eating healthy, you're eating vegetables, fruits, other vitamins, we have it enough in the food. The main vitamin that is not enough in food is vitamin D. So definitely make sure you have enough vitamin D and calcium. So fruits and vegetables, I know, as we all know, fruits and vegetables are the healthy part of our diet. Usually we say we should have, 2.5 serving vegetables a day and 2 serving of the fruits a day. So, serving is, for example, for vegetable, you can say 1 cup is serving. So when we say 2.5, 2.5 cup of the vegetables. Fruits also, you can measure it with cup, or you can say, 1 apple is 1 serving. So at least 2 serving of fruits a day and 2.5 serving of vegetables a day. So this is for the, calculation is for 2000 calorie, just a medium calorie we need. So it decreased the mortality, decreased the heart disease, a stroke, and probably most of this benefit is because of the high fiber in the food. And also cancer, it decreased the GI, gastrointestinal cancer, breast cancer. The other good food that can decrease the cancer, especially for male patients, is tomato. Tomato the research can decrease prostate cancer. So make sure at least 1 of your servings, women also can have tomato is healthy. So at least make sure, 1 of your serving of the fruits are tomato. And it has other things, vitamins, but, as far as cancer for male is prostate cancer. Grains is the other group. So we have 3 kinds of the grains. Refined grains are those that, is not the healthy grain, like a white bread. They remove everything, white bread, white rice, try to decrease that as much as you can. Enriched grain, is the second grain that it means that it is the same white grain, but they add a little vitamin and iron. So the name may look a little fancy, but it's not much different between enriched grain and the refined grain, because, unless they add fiber. But the best one is the whole grain. So whole grain will improve weight, decrease the coronary artery disease, cardiovascular disease, and cancer. So at least half of your grain in a day should be whole grain. So whole grain improve the weight, it decreases the heart disease and also decrease the cancer, especially the colon cancer. And as I said, it's more because of the fiber. So the next healthy things that we have to add in our diet is the dairy. So at least we need to drink 3 cups of the dairy for our 2000 calorie a day. So as I said, it will decrease colon cancer. The research showed that calcium can decrease the colon cancer, and also it helps with the heart disease. So the dairy, as you know, it is milk, cheese, yogurt. If you want to have a dessert, maybe you can pudding, frozen yogurt, ice cream, which actually you have to look at the sugar, not a lot of that, but if you want to, it's better at least than cookie, other candies. So at least it has calcium, but just watch the sugar on it, don't eat too much of that. So as I said, it will help with the colon cancer and also the heart disease. So protein-rich foods, as we said, I want to just bring this, red and processed meat are the worst, red meat and processed meat. So the research showed that they can increase the diabetes, a stroke, colon cancer, and heart disease. Fish, at least if you can do 4 times a week, that will help a lot with your health. If you can do 4 times, at least 2 times a week, as we said, you get or at least do the fish oil, But as far as protein, it's better you choose, something like fish in your protein. Nuts also are very healthy. Nuts will decrease the heart disease, and stroke is a good source of protein. But as I said, try to choose nuts that doesn't have salt. So protein, something we need something like maybe 5 ounces of the protein a day. So it's better to choose the healthy protein, seafoods, poultry, beans, peas, nuts, seeds. And processed food, as I said, is the #1 carcinogens that they proved. So try not to do, you may think, okay, you're eating a processed chicken, chicken nuggets, something like that, but it's not healthy. So you're getting, increasing the risk of cancer. Beverages, try to avoid the sweet ones. It will increase the risk of obesity, heart disease, hypertension. Coffee, maybe this is a good news I give you. Coffee is not bad, so if you don't, unless, not a lot, maybe 1 or 2 cups of coffee is good, unless, you have heart palpitation, heart disease, don't go to more than 1 coffee a day. So it looks that it decrease the liver and uterine cancer. So maybe this was a good one, because everyone loves coffee. All the good things are bad, but this is good. So, the type, there are different type of diets. So we recommend low-fat diet, vegetarian diet, DASH diet, Mediterranean diet, and organic diet. So I will explain a brief of all of those, but DASH diet is a diet that it says actually is diet that approach salt, to a diet that approach to stop the hypertension. So this is the DASH diet. So let me go to next slide. Low-fat diet, maybe the name looks, it is very healthy, but it's usually just helps with the weight, which is good, if you choose the diet that has, especially if you look at the cholesterol, bad, as I said, the processed food, those saturated fat. If we decrease that, we will have a healthy weight. If we have a healthy weight, we will be healthy. The relationship between dietary cholesterol intake and cardiovascular disease is less certain. So it's good to do that, but the research is not 100% compared to other diets that I'm going to talk. The vegetarian diet is one of the other good diets. It can decrease the obesity, heart disease, hypertension, diabetes, cancer. We have different kinds of vegetarian diet. I'm sure you all know that, some of these vegetarian diets, they just, they do vegetables with milk. Some of them also, they add fish, white meats, to the diet. So it depends, what kind of vegetarian diet it is. It is healthy, but they 100% they don't know if it is really the vegetarian diet or vegetarian lifestyle that makes them healthy. Because vegetarian people, they do exercise a lot, they don't smoke, they don't drink alcohol. So overall, they are healthy. So, but it looks that it decreases all of these, problems. Vegan diet is another one, but in vegan diet, because they don't have milk and it's not good for bone density. We have to make sure we are getting enough calcium when we are eating vegan diet. It can increase the risk of osteoporosis. And vitamin B12 is definitely one of those that we have to make sure we add it to our diet. So it's not enough vitamin B12 in vegan diet. So the other diet which is a good diet, we recommend is Mediterranean diet. So Mediterranean diet is a diet with high fruits, vegetables, a lot of vegetables, whole grains, beans. As I said, beans has a lot of fiber, so beans, nuts, seeds. They have olive oil in their diet, and they have a little bit of wine. Their protein is more fish, poultry, dairy, and very little red meat. So red meat should be very little in Mediterranean diet. So it shows that it can decrease the stroke, heart disease, Parkinson, Alzheimer, and cancers, especially cancer, colon cancer, prostate cancer, oropharyngeal cancer, and breast cancer. So Mediterranean diet is one of the good diets that you can follow, if you like this in your diet. The other one, DASH diet. So as I said, the diet approaching stop hypertension. So this diet, it should have 4 to 5 serving of fruits, 4 to 5 serving of vegetables, 2 to 3 serving of the low-fat dairy, and less than 25% of fat. So this diet is mostly work for, heart problems, blood pressure, heart disease. It can also affect colon cancer and gout, but it's mainly for heart disease. So this is also a good diet if you like to follow. Organic diet is good, if you can get organic, but honestly, it decreases the pesticide, but it's really, they don't know if at the long term it can affect the health outcome. But yes, it will decrease the pesticide, and they notice that pesticides can cause some of the cancers like non-Hodgkin lymphoma. So if you can do organic, that's good, but if you can't, that's fine. At least make sure you are getting the healthy diet. So these are actually the WHO recommendations for eating healthy, make sure. So this is a brief, especially for the COVID, this is a new recommendation of the WHO. Make sure you're eating all this variety of the food, whole grains, legumes like lentil, beans, fresh fruits, vegetables, meats. Decrease your salt intake. As I said, don't go more than 2,300, half a teaspoon. And try to avoid salty sauce like soy sauce. Don't put the salt shaker in your table so you don't use it. When you're buying foods, check for the label of the salt. A lot of foods you may not know that it has a lot of salt. Canned food especially are the worst one. Soups, they have a lot of these canned soups. They have a lot of salt. So try to watch those. Decrease your fat intake. Replace healthy fat with replace butter with healthier, like olive oil. Choose white meat, as we discussed. If you're drinking milk, do the low-fat milk. And as we discussed, decrease the trans fat, and try to more steam food instead of frying. Decrease your sugar intake. The same thing that we discussed. Avoid all these sugary drinks, fruit juice. Because a lot of my patients, they even don't know, they drink a lot of juice. They think it's because it's juice is healthy. They say, okay, we get it fresh juice, but it still is not healthy. So eat the whole fruit instead of changing it to juice. So fresh fruits, if you want to snack something, fresh fruits, and avoid canned foods, because some of them have a lot of salt, some of them has a lot of sugar. So look at the label. As far as alcohol, WHO says there is no level of alcohol that we can tell you it's safe for you. So try to avoid alcohol as much as you can. Try to drink water instead of all these sweets, the drinks that are sweet. And that's it. If you have any questions, I will be happy to answer. Thank you.